Risperidone can be given as risperidone consta, which is microspheres, and that is given every 2 weeks as an injection. When initiating, since it takes a longer period of time until risperidone consta actually reaches therapeutic blood levels, there's a 3-week time period where oral risperidone needs to be given. The safety and efficacy of risperidone consta is basically similar to that of risperidone oral, and the efficacy has been demonstrated, leading to FDA approval. Aripiprazole is delivered in 2 different forms. There's aripiprazole maintena, which has a once monthly injection. You would start at 400 milligrams in all patients, and only in those patients who have some tolerability issues. In studies, it's less than 10%. You might be able to go down to 300 milligrams once monthly. Here again, like with risperidone consta, there is a lag time until therapeutic levels are achieved. So here, a 2-week time frame with oral aripiprazole between 10 and 20 milligrams is required. There's also aripiprazole Loroxal that comes in different dosages, and depending on the dose, it can be given once every 4 weeks, every 6 weeks, or even every 8 weeks. Obviously, if it's 6 or 8 weeks, the overall dose that is achieved in the blood is closer to 10 or 15 milligrams, maybe 20, whereas if you have monthly injections, you can even go up to an equivalent of 30 milligrams. With the usual injection of aripiprazole Loroxal, there is a 3-week time period that is required when oral aripiprazole is co-administered until the Loroxal formulation reaches its therapeutic blood levels. But with a new formulation, the Loroxal Initio, which reaches blood levels that are therapeutic within 2 or 3 days, there is only 1 dose of 30 milligrams oral aripiprazole required, and no further oral co-administration is needed.
In the case of paliperdone, we do have 2 different injection intervals. So there's the once monthly, and there's the once every 3 months. And you have to start on the once monthly, and then once someone has demonstrated their response and stability on that after a few months, then you can switch to the every 3-month injection. I think, again, it's going to vary from patient to patient, but I think for many people, having an injection once every 3 months is a tremendous advantage. I mean, it really eliminates a lot of burden. If I can say to my patient and his or her family, you know, you only have to come and have an injection 4 times a year, I mean, that's a very low burden, so to speak. I think what confuses people at times is they think, well, that's going to determine the frequency with which the patient is seen by a mental health professional. And to me, those are 2 different issues. I mean, when you receive your injection is one issue, and how often you see your therapist or your group therapist or your rehabilitation counselor or whatever it is, that's a different question. They don't have to be linked. So I think that having less frequent injections can be very helpful for people. You don't have to remember to take pills every day, and you know that you're covered. The families also are often very much in favor of this because they don't have to worry. I mean, if you have had a family member who has had a psychotic relapse and you've had to call the police to take that person to a hospital, you know, potentially against their will, that's a really traumatic experience for everyone, for the patient, for the family. And when that person it improves and leaves the hospital, the family, it's understandable for them to be very concerned about whether or not that person is taking his or her medicine. So that can lead to a lot of family kind of conflict. And if someone's receiving a long-acting formulation, then that's not a necessary conversation. So I think the families often feel very relieved when someone is receiving their medicine via that route. There have been a number of studies demonstrated that in patients who had only been ill for 5 years, that the long-acting injectable formulation of paliperdone was associated with a significant reduction in negative outcomes. And so, but there have been several studies that have been done now in first episode and early phase patients, which show that the use of long-acting formulations can be very powerful in reducing the risk of relapse and hospitalization, even in someone who's only had one hospitalization for schizophrenia. So I think that's very important to recognize that we can have an impact on the early course of illness. And in my opinion, reducing the risk of relapse at that point in time is particularly critical, because if you think about a young person who has had one psychotic episode, but is now, feeling much better and going back to school or back to work, if that person has another psychotic episode and has to be hospitalized again, that can lead to tremendous disruption in their trajectory in terms of trying to get back to a relatively normal life. So at an early age, even just one or two relapses can really lead to a sort of erosion of some of life's opportunities. And we really want to avoid that, particularly in the early stages of the illness. That's when we have a chance to really facilitate recovery. So we really want to work hard to avoid any possible relapse if we can.